Good morning to everybody who is attending my lecture series. Today I am discussing on the diagnostic criteria for diabetes mellitus. In the recent report, an international expert committee, after an extensive review of both the established and emerging epidemiological evidence, recommended the use of the A1C test to diagnose diabetes with a threshold of more than or equal to 6.5%, and ADA has affirmed this decision. Thus, the ADA recommended diagnostic criteria for diabetes mellitus categories of increased risk of diabetes. In 1997 and 2003, the Expert Committee on the Diagnosis and Classification of Diabetes mellitus recognized an intermediate group of individuals whose glucose levels, although not meeting the criteria for diabetes and nevertheless too high to be considered normal. This group was defined as having impaired fasting glucose, IFG, FPG, fasting FPG, levels of levels of 100 milligram per deciliter, that is 5.6 millimole per liter, to 125 milligram per deciliter, or impaired glucose tolerance test, that is 2 hour oral glucose tolerance test values of 140 milligram per deciliter to 199 milligram per deciliter. As the A1C becomes increasingly used to diagnose the diabetes in individuals with risk factor, it will also identify those at the high risk for developing diabetes for the future. Now, this next portion describes the categories of increased risk factors for diabetes. Patients with impaired glucose tolerance test, that is IGT, and or impaired fasting glucose are now referred to as having prediabetes, indicating the relatively high risk for development of diabetes in these patients. In the absence of pregnancy, the absence of pregnancy, IFG and IGT are not indicated, are not clinical entities in their own right, but rather risk factors for future diabetes as well as cardiovascular disease. IFG and IGT are associated with the metabolic syndromes, which includes the obesity, especially abdominal or visceral obesity. Dyslipidemias of the high triglyceride and or high density lipoprotein, that is HDL type, and hypertension. It is worth mentioning that medical nutrition therapy aimed at producing 5 to 10% loss of body weight, exercise, and certain pharmacological agents have been variably demonstrated to prevent or delay the development of diabetes in people with IGT. The potential impact of such intervention to reduce the cardiovascular risk has not been examined to date. Note that many individuals with IGT are euglycemic in their daily lives. Individuals with IFG or IGT may have normal or near normal glycated hemoglobin levels. Individuals with the IGT often manifest the hyperglycemia only when challenged with the oral glucose load used in the standardized oral glucose tolerance test, that is OGTT. Criteria for the diagnosis of diabetes. A1C equal to or more than 6.5%, the test should be performed in a laboratory using a method that is certified and standardized to the assay, or fasting plasma glucose more than 125, more than or equal to 125 milligram per deciliter. Fasting is defined as no caloric intake for at least 8 hours. A 2-hour plasma glucose of more than 200 milligram per deciliter during an OGTT, the test should be performed as described by the World Health Organization, using a glucose load containing the equivalent of 75 gram of anhydrous glucose dissolved in water, or in a patient with a classic symptoms of hyperglycemia or hyperglycemic coma, a random plasma glucose more than or equal to 200 milligram %. Plasma glucose values in the IGT and IFG. Fasting plasma glucose pre-diabetes is 100 to 125, that is the impaired fasting glucose, IFG. And diabetes mellitus when it is more than or equal to 126. 2 hours after glucose load, that is pre-diabetes will be 140 to 199, that is the pre-diabetes. And diabetes, it is more than or equal to 200. A1C in pre-diabetes is 5.7 to 6.4. Diabetes mellitus, it is more than or equal to 6.5. It has been variably demonstrated to prevent or delay the development of diabetes in the people with IGT. The potential impact of these interventions to reduce the cardiovascular risk has not been examined to date. Note that many individuals with IGT are euglycemic in their daily lives. Individuals with IFG or IGT may have normal or near normal glycated hemoglobin levels. Individuals with IGT often manifest hyperglycemia only when challenged with the oral glucose load used in the standardized oral glucose tolerance test. Thank you. We come to the end of my lecture discussion for today.